Omicron raging in just about every part of the country. Many Americans believe that getting infected is now inevitable. Doctors say that's simply not true.
And Rob Sneed talked to a local health official. He joins us live from Stroger Hospital with more tonight. Rob?
This afternoon, Cook County health officials say that you must not put your guard down. Hospitalizations, as you guys mentioned, are high. They say you must protect yourselves. COVID-19 hospitalizations are high right now.
I think we're hearing a lot of a sense of inevitability that COVID, Omicron's here, we're all going to get it. And we're asking people to rethink that.
More than 7,300 people taking up hospital beds in Illinois. Of those, 80% unvaccinated.
This surge is really out of control. I mean, we have a lot of people that are positive. It's highly contagious. You know, we're letting our guard down a little bit, understandably, but it's just causing a really rapid spike, and there are still enough people that are sick and hospitalized. Our hospitals are now full.
Dr. Mark Loafman with Cook County Health says there are so many myths about how to handle the Omicron virus.
We're hearing about this, COVID parties or people intentionally, I hope I get it, to be done with it, and that used to happen with chickenpox. So we've learned that's not the best strategy. The best strategy is to mitigate and avoid and use masks and isolate and vaccinate.
Dr. Loafman says the increase in hospitalizations are putting a strain on medical professionals. Just yesterday, the governor said he would deploy more than 2,000 healthcare workers across the state and some of the hardest hit areas of the state by Friday. National Nurses United, the largest nurses union, says there isn't a nursing shortage, just a shortage of nurses willing to work in unsafe conditions.
The hospitals need to invest in more staffing and hire, nurses in a number where they're safely taking care of patients. A medical ICU nurse should not have to take care of 3 patients at a time. That's just unsafe for the patients. It's unsafe for the nurse. Mistakes, are bound to happen because one nurse cannot take care of 3 critically ill patients.
As hospitals work to figure out their plan of attack against COVID-19, some residents continue to wonder. Isn't it inevitable? Are we all going to get it eventually?
I don't think it's inevitable that we're all going to get it. I think the more people that do get it and spread it, the more of us will get it. So we're seeing that play out very much right now.
And Dr. Loafman also says folks must continue to social distance, wash their hands, and of course get vaccinated. Reporting live on the city's west side, Rob Sneed, WGN News.
All right, Rob, thanks.